Assalamualaikum warahmatullahi wabarakatuh. My name is Widya Khaerani. In this video, I would like to explain about the current issue in psycholinguistics around my environment. So the issue that occurs around me is the language disorders of children who are born prematurely. I adopt this problem from a child who was born prematurely. Her name is Febi Analisa. She is my cousin. She born at 26 weeks of pregnancy, and she has language disorders. Also, she has visual disturbances. According to Dewi and Sarnia 2016, one of the major problems arising from premature birth is visual disturbances and also milder disorders such as language disorders. Baby can understand the language that used by other people, but other people find the difficulty to understand the language that used by baby. For example, when her parents talk to her, actually she can understand very well, but she still has difficulty to answering her parents' question. And when she wants something, uh, he he only use one word or two words because he still cannot compose a sentence. Even though children who have same age with her can already speak fluently. Next, I will explain about the language disorder of children who are born prematurely according to based on several sources. First, language disorders. Language disorders is a type of disorders in communication with an indication that someone has disturbance in the symbolic process. And this difficulty results in a person being unable to provide accepted symbol and unable to change the concept of understanding symbols that can be understood by others. And language disorder is commonly known as development disorders and expressive language. According to FND in Nur Hidayati et al. 2013, there are several causes of speech delays, such as first, medical factors. These factors is the malfunctioning of the central nervous system caused by injury or bruise. This is known as aphasia, which is the loss of the ability to speak due to disturbances in the central nerve. Injury or bruise in the brain occurs due to various events, one of which is premature birth. And the second is physiological condition. This condition is the ability of the organ involved in carrying out their function to support the children's fluency in developing speech and language. These organs include speech organs, hearing organs, and nervous system. And the last is environmental condition. Next, about premature labor. According to Devi and Sarnia 2016, premature labor is birth that occurs before the womb reaches 37 weeks. Premature babies have a higher risk of death than babies born at term because they have difficulty to adapt life outside the womb due to immaturity of their organ systems. According to Putri et al. 2018, there are some of risk of growth and development disorders for premature babies, namely hearing and vision, language skills, psychomotor and behavior, cognitive abilities, and emotional development. And there are another problem that can arise due to premature birth is neurological development problems, from severe neurological disorders like blindness, visual disturbances, and deafness, And also premature birth can result in less severe disorders like behavior disorders, learning and language difficulties, and concentration problems. And next, the relationship between premature and language development. The significant brain development in baby occurs in the last 4 until 6 weeks of pregnancy. Babies born less than 37 weeks or premature birth have risk of health problem that can increase the risk of developmental academics disabilities. The risk of disorders increase in babies born at younger gestational age. Premature labor is a major cause of neurodevelopmental disorders in children. What is neurodevelopmental disorders? These disorders are disabilities associated primarily with the functioning of the neurological system and brain. And children with these disorders experience difficulties with language and speak, motor skills, behavior, memory, learning, or other neurological function. So there is a relationship between preterm birth and development of the language. Some babies born prematurely have neurodevelopmental disorders, and one of the consequences of these disorders in premature babies is language and skills. And most premature babies have language problems during the first few years of birth, including understanding sentence, expressing themselves through language, processing words, articulation or pronunciation, and so on. So we can, from my explanation before, we can conclude that the language skill of premature children have delay in language. The delay in children's language skill are influenced by brain development. Babies born prematurely have complex problems because all organs of the babies are immature or term. Okay, that's all from my explanation. Wassalamualaikum warahmatullahi wabarakatuh.